This is a collaboration between the Nursing Arts Lab at SLCC and the Performance Department.
We are a standardized patient for the nursing program over here at Salt Lake Community College, and we are portraying a family member that has a terminally ill family member that is going to pass away. And what we do is we have nursing students come in and they have to check the vitals of said family member, and all of a sudden the family member crashes. And so what the nurses have to deal with then is us having these emotional rebounds of our family member dying and them actually having to respond to what we're doing.
There are lots of programs throughout the country in well-known medical schools that utilize what we call standardized patients.
A standardized patient is basically a group of actors who come into a nursing school training program and act as patients or family members of patients in order to introduce the nurses into how it will be once they get out of school.
The doctors or the medical students have an opportunity to have a real encounter with a patient, but there's nothing at stake because they're actors. You are not going to fail as an SP if you don't have teardrops falling from your face. I mean, there's no preconceived requirement for you. I'm more concerned about putting the nursing student in a position where they have to deal with some extreme emotion.
A lot of the times, the standardized patient, who is me, will have an illness or something, obviously, that the nurse is treating. In the case we're working on right now, we're actually family members of someone who is dying.
Hi.
Hi.
How are you?
I'm doing okay, I suppose. What are you doing?
Oh, this is just routine vitals.
What does that mean?
We just periodically come in and check his vitals. I'm just checking up on your dad. The actors could take it as a form of actor training. I mean, it's because it's a special skill. It's improv for them, but it's improv under very specific guidelines. The goal for us is to standardize the actors so that, when a nursing student shows up and there's 3 rooms to choose from, that it doesn't matter which room they go into. They're going to have a similar experience based on how they treat the patient.
We just had an exercise with in our nursing lab here to simulate an end-stage pancreatic cancer patient who was passing away, and the exercise was to kind of connect with the family and kind of bring them into the process and let them know what was happening, and also be there and kind of monitoring our patients.
We don't know when your dad might pass. It could be really quickly. It could, just gauging off of some of the vital signs, it could be at any time. And from what I've been told, he is at the end stage. And so what I want to just kind of encourage you to do is take this time and be with him.
To be honest, I think I have mixed feelings about it. I don't know necessarily. I mean, there's no way you can actually really create a real life situation. So how I would react in a real life situation versus, just a simulation, even just knowing that it's a simulation, I'm going to react a little bit differently.
They're also coached to reflect back to the nursing student what they're getting. So for example, if a nursing student comes in and kind of seems detached and cold, or maybe just going through the motions, then my actors are instructed to reflect that back.
I'm really new, so I actually don't know how to do this very well, so it's not working.
In the training, we have one instructor who was playing the nurse for us every time. And yes, she tried to shake it up a little bit or be more obtuse or be more aggressive or be more empathetic, but regardless, she was still the same person with the same mannerisms, and I wanted a bit of a challenge, so I volunteered to be the nurse.
I'm just gonna try this.
It's not working.
Well, I think it's just me. I'm
I got
really
family 2 hours away coming here.
You know what? I'm just gonna I'm just really new, but I'm gonna try it again, and it'll be fine. It'll be fine. He's actually, I don't know that it's gonna be fine.
What do you mean?
Like, okay, I'm just gonna go get some help
No.
really quick.
What am I supposed to do? I got family coming to see him.
Well, I think that he's not now.
We have a grading scale 1 to 5, and usually they get all 1s or they get all 5s. If they're really good, they're really good. If they're not, they're not. And my goal was for the SP, the standardized patient, to give me a real scattered grading. So I wanted to be extremely empathetic. I wanted to be loving and nurturing. I wanted to put my hand on his shoulder. I wanted to have great facial expressions and give him eye contact, but also be a really terrible nurse.
It gives them an opportunity to see it from both sides. So they get to be the nurse for a minute, and then they get to kind of think about, what qualities am I looking for in this nurse? What things do I want the nurse to say or do? And then when they fill out their evaluation, they can, if a nurse comes in and is terrible, then they have a lot of things to say. You didn't look at me, or you seemed really cold and mean when you talked about the condition of my dad, or whatever. But they could also be really great. And I've told my standardized patients, if the nurse comes in and is really great, you need to tell them why. You need to encourage them and tell them why. And so it's important, I think, for the SPs to put themselves in that position and try to be the nurse.
So like your interaction was over, but they just stayed in the room?
Yeah, and I think they were trying to be comforting, and I gave them points for that, obviously.
Yeah.
But it was just so awkward. They did, I mean, obviously, what do you do? Just stand there.
I am a first semester, so I've only been in school in the nursing program here for about 3 or 4 weeks. I think they did a good job. When I was in there, the family member didn't say a whole lot. They just kept asking me what was going on, and I was still trying to assess what was going on. So it was kind of, a urged rush thing.
I think it's a good exercise just because it gets your mind rolling about these kinds of situations and what you would do as a nurse in this type of situation, because when you're working as a nurse, there is going to be a time where you have to deal with something like that.
We'd like to have the nursing students take it as like a lab, where once a week they would come and they would just have this scenario where they would go and deal with an SP, and they don't know what they're going to get, and they just come in and they deal with it as best they can right there in the throes of it all, and they would get that experience once a week for the duration of the semester. And then the other advantage to that is that provides us with funds to keep the program going.